One of the most common questions I get asked is, can I stay on Ozempic or GLP-1 agonists while doing fertility treatment? The short answer is yes, but with careful planning. GLP-1 agonists, medications like Ozempic or Wegovy, Mounjaro, these all work by mimicking a hormone in our gut that slows down how quickly our stomach empties. This can help us to feel full longer and can help us reduce our appetite. They can also make you more sensitive to the effects of insulin. So as a result, you're eating less, your blood sugar is more stable, and this is especially important if you're someone who's dealing with insulin resistance. Insulin resistance is really common and often underdiagnosed. It's something that I talk about at length in my book, The Lucky Egg. Insulin resistance can negatively impact egg quality and implantation potential. So it's all about optimizing the foundation for a healthy pregnancy. But timing is everything. When you're prepping for an egg retrieval, you're going to undergo sedation, anesthesia at time of retrieval. And one major concern about being on a GLP-1 while undergoing anesthesia is the risk of aspiration. Because these meds work by slowing the rate at which your stomach empties, food can linger for longer. You can have an increased risk of that food coming back up under anesthesia where you don't have the same reflexes that you normally have when you're awake. So here's what I typically advise. Stop your GLP-1 agonist once you start your stimulation shots. That should give you a buffer of at least 10 to 12 days of being on the medication before your retrieval. And if you're not trying to conceive right away, you're just freezing eggs or embryos, once your retrieval's over, if you're feeling fine on post-op day 1, you can resume your GLP-1 the day after. Now, if you're going through fertility treatment with the intention of getting pregnant and you're prepping for an embryo transfer right after the retrieval, then the advice is a little bit different. GLP agonists are not recommended in pregnancy because of potential risks that have been seen in animal studies, things like birth defects and a risk of miscarriage. And although we don't have all the human data we need about safety, we want to err on the side of caution. The half-life of these medications is long, and the guideline is to stop the GLP-1 at least 2 months before trying to conceive. We're prepping for an embryo transfer, which usually takes about 3 weeks of prep, whether you're talking a cryo-natural or medicated prep. You'll want to take your last dose of GLP-1 agonist, ideally around 5 to 6 weeks before you even begin prepping for an embryo transfer. That way you're off of the medication for the recommended 8 weeks, 2 months before possibly being pregnant. A common concern I get asked about is, well, what if the insulin resistance starts creeping back? I'm worried about losing all of the progress that I've made and how that's going to affect the eventual chance of transfer success. So that's where drugs like metformin can come in. While it doesn't help you lose weight, it can still make your body more sensitive to the effects of insulin, and we can use it safely during fertility treatments, even in early pregnancy, depending on an individual case. Being pregnant is a state of relative insulin resistance because the placenta secretes a hormone called human placental lactogen, which directly opposes the effects of insulin. So a lot of us are set up for insulin resistance and problems like gestational diabetes, especially if we have an underlying predisposition. There are ways to be strategic when it comes to your weight loss journey, when it comes to treating and combating insulin resistance around fertility treatments, but it's about working with your individual case, talking to your fertility doctor, and coming up with a plan that fits your body and your goals.